In San Francisco, people waited in line to get vaccinated for monkeypox, a virus that is spreading so rapidly, the World Health Organization has now declared it a global health emergency.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
There have been about 3,000 cases in the U.S. so far, and many more in Europe and dozens of other countries, including India, Russia, and Brazil. Matt Ford battled the virus for more than 3 weeks.
It was excruciating at times. I had intense flu-like symptoms, so fever, chills, sore throat, cough, sweating through my sheets at night. And then, the telltale skin lesions, which I had from the get-go, but more of them appeared throughout the infection. And towards the end, I counted more than 25 all over my body, and they just appeared everywhere. At worst on more sensitive skin and more sensitive areas.
Women and children in the U.S. have caught monkeypox, but the U.S. Centers for Disease Control says 99% of the cases are seen among gay and bisexual men. The disease is spread by close, skin-to-skin body contact. Monkeypox vaccine and testing kits are in short supply, frustrating health experts.
I think we kind of stumbled out of the blocks in a few ways, one of which is testing. I don't think there was enough testing available early enough. And then the second thing is with the vaccines. We have vaccines available, they're approved, we have them purchased. They are in a national stockpile, and it's been getting them out of the stockpile has been really challenging, and that's currently where the bottleneck is right now.
The White House says the government has distributed 300,000 doses of monkeypox vaccine and is trying to speed up the shipment of about 800,000 more doses from Denmark, where they are manufactured. But that may be too little, too late.
I think I'm very worried that the window for containing this outbreak is closing quite quickly. And so without the vaccines, I'm just very nervous that we're not going to be able to contain this as quickly as we'd like.
Matt Ford said he's disappointed that the public health response to the outbreak seems sluggish.
Yeah, I think the government response has been very flawed and very delayed.
2.5 years of dealing with the COVID pandemic, public health systems in the U.S. and elsewhere are stretched to their limits and ill-prepared to handle new outbreaks of disease. Rob Reynolds, Al Jazeera, Los Angeles.
Jack Chow is the former WHO Assistant Director General and a global health professor at Carnegie Mellon University. Joins me now from Washington, D.C. Jack, by no means is the WHO unified on this. There are a lot of dissenting voices within this, whether it should have been declared a global health emergency. It's been declared that. Is this the WHO erring on the side of caution, or is this urging governments to do more?
Well, thank you for having me. The WHO convened two experts meetings to deliberate on the severity and the urgency of responding to this crisis. And they developed a series of what I would call a epidemiological dashboard. And experts can reasonably look at the data over the past month and think, well, there are some indicators that point rather that it's not as severe as one would think. However, the critical weakness of the data is that it often lags reality, that the virus may be ahead of the data. So it's in my judgment that Dr. Tedros is erring on the side of taking proaction to mobilize governments and mobilize civil society. It's not only a medical response, it's a political response. And that is what is needed at all countries, at all community levels, in order to truncate the epidemic at the bud.
We have a lot of, right now, pandemic fatigue. People, ordinary people, are just fed up of the restrictions that came with coronavirus, travel restrictions, the masks, et cetera, et cetera. We almost now are rolling into this idea that monkeypox may be spreading. And once again, people are just like, well, it turned out that COVID wasn't that bad. I mean, that's what people think. Maybe this isn't that bad either. You are fighting a public information campaign here as well, right?
Yes, we've gone through 2 years of COVID, and there's a pervasive psychological resignation, unfortunately, to the pandemic and to the voice of science. And now we have monkeypox, and monkeypox can be very dangerous, particularly to pregnant women and their developing fetus. It can be very dangerous to the immunocompromised. And in certain circumstances, it can cause brain and spinal cord infection and even blindness. So while there are patients, such as the gentleman who you interviewed earlier, who have a self-limited course, in many places of the world with fragile health systems, death and disability, as well as fear, stigma, and discrimination can result. So it really takes a concerted action at the global level to hopefully eradicate what's going on right now.
Well, the good news is that there is a vaccine. The bad news is that in America, the vaccine has been stockpiled. Getting out of that stockpile is proving to be difficult. Denmark, which manufactures the vaccine, hasn't got the capacity to get it out internationally, not least quickly anyway. How much of that is a worry?
What is needed is a fulsome response, a blossoming of public health capabilities that's commensurate with the exponential growth of the epidemic. We've seen in the COVID campaigns that if PPE and the ventilators are insufficient, then the virus runs rampant and hospitals are swamped. So it is absolutely essential that the supply chains open up full bore, and the public health officials and first line implementers have the equipment, have the supplies that they need so that patients can avail themselves of the antivirals and the vaccines as soon as possible.
But Jack, if that's the case, then why not force governments by making this much more stronger than just an advisory? Because an advisory means that governments internationally can ignore it. If it's that much of a problem, if we need to get this vaccine out, why don't we make it a pandemic?
Well, what we need is, quite frankly, a pandemic response treaty, and that has been proposed. It is going through the slow diplomatic processes, but monkeypox ought to be compelling what I would call a medical NATO type of response, that countries should knit together and release stockpiles, deploy personnel to the front lines as soon as possible. The Global Health Emergency Declaration, WHO is a member state organization. It cannot command countries. It can advise and support countries, but Dr. Tedros' declaration is an important signal because it allows WHO a foothold into the offices of presidents and prime ministers to say fighting monkeypox, fighting COVID, fighting future pandemics is a political responsibility as it is a public health responsibility to their constituents.
Jack Chow, live from Washington, D.C. Great to have your thoughts. Thank you.